This seizure disorder presentation is based on the standard material produced by the Unified Referral and Intake System. It is intended to provide general information about seizure disorders to schools, licensed child care facilities, and agencies providing respite. The brain controls the body, including movements, sensations, thoughts, and emotions. It contains billions of nerve cells that communicate with each other through electrical signals. When a person has a seizure, the brain sends out an abnormal burst of electrical signals. These signals can change a person's movement, behavior, or state of awareness. A seizure is often very brief, lasting from a few seconds to a few minutes. If a person has multiple seizures, they may be diagnosed with a seizure disorder. Common causes of seizures include problems with brain development before birth, lack of oxygen or damage to the brain during birth or after birth, brain injury, infection, or tumor, metabolic conditions, and interruptions in blood flow to the brain, such as a stroke. Recognizing triggers may help to minimize the number of seizures that a child experiences. However, a person's triggers are not always known, and they will vary from person to person. Things that may trigger seizures include missing a dose of anti-seizure medication, stress, excitement, or extreme emotions, poor lifestyle habits, lack of sleep, flickering lights such as strobe lights, videos, or computer games, illness, heat or humidity, and hormonal changes during puberty or menstrual periods. Daily anti-seizure medication is the most common treatment for seizures and is usually taken at home. Some children may be prescribed rescue medication, such as Lorazepam or midazolam. Other treatments include surgery, ketogenic diet, and vagus nerve stimulation. Rescue medication is used to stop a seizure or to prevent further seizures. Lorazepam is a tablet that is placed in the cheek pocket and is absorbed into the bloodstream through the inner cheek. Midazolam is a liquid medication and is sprayed into the nose using a syringe. If a child in your care is prescribed rescue medication, the nurse will provide more detailed instructions. A seizure disorder should not interfere with a child's ability to enjoy routine activities. However, precautions may be required for some activities if their seizures are not well controlled, such as swimming, cycling, and climbing. If a child in your care has specific precautions, they will be included in their healthcare plan. There are two main types of seizures, generalized and partial. Generalized seizures occur in the whole brain. Partial seizures occur in one part of the brain. An individual may have more than one type of seizure. Seizures can also vary in the same person in terms of length, frequency, and severity. There are several types of generalized seizures, such as tonic-clonic, absence, myoclonic, and atonic. Partial seizures include simple partial and complex partial. Tonic-clonic seizures will be described in more detail in this video. If a child in your care has other types of seizures, the nurse will provide additional information. A tonic-clonic seizure is generalized and is the type of seizure that most people are familiar with. Also, any seizure, regardless of what type it is, can become a tonic-clonic seizure if it does not stop on its own. During a tonic-clonic seizure, the child loses consciousness. Their body stiffens, which is the tonic phase. The body jerks repeatedly. This is the clonic phase. The child may cry out, clench their teeth, bite their tongue, drool, or have increased salivation. The child may have changes in breathing. Their skin may turn pale or blue-gray. They may lose bladder or bowel control. When a child has a tonic-clonic seizure, note the time when you become aware of the seizure. Place the child in a side-lying position to keep their airway open. Loosen any tight clothing around their neck. Move any objects that may injure the child. Stay with them until they are alert. After the seizure, reassure and comfort the child, and contact their parent to let them know their child has had a seizure. During a tonic-clonic seizure, do not leave the child unattended. Do not restrain them. Do not put anything in their mouth, as it could cause teeth or jaw damage. The child will not swallow their tongue. Do not offer food or drink until they are fully alert. Do not place anything large under their head, as it may affect the airway. The head and neck may be cushioned with something soft and small, such as a jacket. This video shows a child experiencing a tonic-clonic seizure. Please note that the child should be placed in a sideline position immediately.
5, 6, 7, 8. 1, 2, 3, 4. 2, 2, 3, 4. 3, 2, 3, 4. 4, 2, 3, 4.
Is she shaking like that? What's she doing?
You just move back a little bit, please.
She's still shaking.
Right, Sarah, can you go and get Mr. Bosworth for me? Joanne, can I have your jumper? Olivia, can you just go and wait in the corner for me over there? Hi Molly, it's Miss Sharp. We're in the gym and you're okay, but you've had one of your seizures. It's going to be just fine. Alright, I just need you to relax, try your best to rest.
It is important to document information about a child's seizure, as it can help the family and physician identify patterns or triggers. Information to document includes how long the seizure lasted, when the seizure occurred, activities that the child was doing when the seizure started, and a description of what happened during and after the seizure, such as body movement, change in color, or level of awareness. Just describe what you see. Seizures typically last a few seconds or minutes, but on rare occasions, a seizure may not stop on its own. When a seizure lasts longer than 5 minutes, the child may be at risk for status epilepticus, which is a prolonged seizure. This is considered a medical emergency. Other emergency situations include repetitive seizures that occur every few minutes with no recovery in between, serious injury that occurred as a result of the seizure, airway obstruction, choking, and if the child has diabetes or is pregnant. If a child does not have a history of seizures and experiences a seizure for the first time, 911 should be called immediately. If any of these situations occur, call 911. Contact the child's parent. These tasks should be delegated to a responsible person while you stay with the child. Remain with the child until medical personnel arrive. Lorazepam is a rescue medication that is used to stop a seizure or prevent further seizures from occurring in a cluster. It is prescribed by a physician to be given if a seizure continues for a specific length of time. Lorazepam is a tablet that comes in different strengths. It is placed in the cheek pocket where it dissolves and is absorbed into the bloodstream through the inner cheek. Lorazepam has sedative properties which can affect breathing and heart rate. Therefore, only one dose can be administered in a 24-hour period at the community program. Place the Lorazepam tablet into the cheek pocket between the inner cheek and lower gum. Gently massage the outer cheek to help it dissolve. Call 911 if the seizure does not stop after the specified amount of time that is included in the child's health care plan. The amount of time will never exceed 5 minutes. Stay with the child until medical personnel arrive. The nurse will provide additional information, if necessary, on specific needs of children in your care. Instructions on when to administer Lorazepam and call 911 is included in the child's health care plan. If you do not know which children in your care have Lorazepam or how to access their health care plan, talk to your administrator. The nurse will provide additional information, if necessary, on specific needs of children in your care. Also, instructions on how to respond to a child's seizures is included in their health care plan. If you do not know which children in your care have a seizure disorder or how to access their health care plan, talk to your administrator.